Hello, myself Shudip Pal. I'm a strength and conditioning coach. I'm currently pursuing my master's on performance coaching from Setanta College. This assessment was done for one of my master's module, that is movement analysis and biomedical aspects. According to Lindblad and colleagues, participating in sport increases the risk of injury by 13 to 35%, and the injury risk is higher in training rather than in competition. Moreover, according to Young and colleagues in 2007, 58 to 78% of the injuries occurs at the knee and the ankle joint. For this reason, movement screening is an important component in today's sport as it provides an overview of an athlete's posture, which helps the strength and conditioning coaches and the sports scientists working with that particular athlete to get an insight of the posture and to work according to that, which at the end will reduce the risk of injury. For this current study, two movement screening tests were conducted on a badminton athlete. The first test is the soleus wall test, which is done to assess the ankle dorsiflexion range of motion, and the closed kinetic chain upper extremity stability test. This test is done to assess the stability of the shoulder. Badminton is considered to be a complex, dynamic, and a fast racket sport that requires specific physical as well as physiological attributes. Moreover, playing badminton requires an athlete to jump explosively along with variety of strokes and dribbles at the net along with lunges. A badminton match can last up to 45 to 60 minutes of duration. According to Abian and Sampedro 2013, a mean rally duration during a men's badminton match in Beijing Olympics was reported to be 11.2 plus minus 1.2 seconds with a recovery of 15.2 plus minus 1.6 seconds between rallies. For this reason, playing badminton places high demands on both the anaerobic as well as the aerobic system during a gameplay. For the purpose of this study, a national junior level male badminton athlete was recruited. The athlete had a training age of 5 plus years and was currently playing at junior national level tournament. The athlete was free from any injuries and did not report any injuries in the last 6 months. The athlete was also doing his skill session along with the strength and conditioning training for 6 days a week. The athlete was informed about the risk and benefits of the study, and an informed consent form was also taken from him. During the time of testing, the team doctor prescribed that the athlete was free from any kind of muscular injuries or health disorders, and an ethical approval was also taken from the director of the academy in which this study was conducted. Ankle sprain is a common injury in badminton with high reoccurrence rate. Decreased in ankle dorsiflexion range of motion has been shown to be the major cause of repetitive ankle sprain in a badminton athlete. According to Dries LK and Hartel J 2009, a poor dorsiflexion range of motion have been shown to alter the running biomechanics in a badminton athlete. During a gameplay, a badminton athlete has to laterally take off to hit a shuttle, but a poor dorsiflexion range of motion at the ankle joint can cause an inversion and internal rotation forces at the ankle joint. Thus, screening for ankle dorsiflexion range of motion is an important factor to reduce the risk of ankle sprain in a badminton athlete. Finally, the soleus wall test is considered to be a valid and reliable test to measure the ankle dorsiflexion range of motion and is used by many team sport as well as individual athlete in the world. Shoulder instability is common in badminton and that can cause a range of injuries such as shoulder dislocation. During smashing a shuttle, it is of utmost importance for a badminton athlete to make a smooth transition from one phase to another, maintaining the maximum amount of kinetic energy until the shuttle hits the racket. Shoulder instability generally occurs in a badminton athlete due to excessive abduction and external rotation of the glenohumeral joint, which if not cured may lead to severe injury like a shoulder tear or a dislocation. Thus, during competition or training, a badminton athlete provides a unique challenge that requires the glenohumeral joint to exceed its physiologic limit, and that can lead to a devastating injury. Moreover, the presence of instability in the shoulder joint cannot be diagnosed without proper physical examination. Thus, screening for shoulder stability is an important is of utmost importance for overhead sport athletes like badminton to reduce the risk of injury. Finally, the closed kinetic chain upper extremity stability test is considered to be a valid and reliable test to measure the stability of the shoulder, and it is used by many team sports as well as individual athlete in the world. For the soleus wall test, a measurement tape and one piece of athletic strip is required. After that, a 10 centimeter mark away from the wall was measured. To administer the test, the athlete was asked to be in a barefoot position while maintaining a half kneeling upright posture, place his 1 foot just behind the 10 centimeter mark, and was asked to move the knee to touch the wall while maintaining the heel on the ground. The test was completed on both the right and the left leg. And for the closed kinetic chain upper extremity stability test, a measurement tape as well as two pieces of athletic strip was taken. After that, two athletic strip was placed parallel to each other, which was 90 centimeter apart. The athlete was informed to put his hand on each athletic strip while assuming a push-up position. From this position, the athlete with his one hand has to reach across the body and touch the opposite hand. The test was completed from the other hand also. The test was continued for 15 seconds and the number of touches were counted. 3 trials were performed by the athlete, and after one trial a 45 seconds break was also given. Previous study has reported that a poor ankle dorsiflexion range of motion and fatigue negatively affects the performance of a badminton athlete, as the athlete requires to perform a great lunge and return to the original position to play the next stroke. Moreover, studies have also reported that a poor range of motion at the ankle may lead to an increase in the inversion angle of the ankle and external rotation at the knee, which is a major cause for ankle sprains and tears at the knee. In this current study, the athlete showed a normal range of motion as shown in figure 7 and figure 8, as the athlete, while maintaining an upright posture, touches the knee in the wall without raising the heel, and the knee is also aligned over the second toe, so the test is considered to be a negative. For this reason, the athlete just needs to maintain this range of motion while adding open and closed kinetic chain exercises along with proprioception and calf muscle strengthening, which at the end will improve the neuromuscular efficiency of the ankle joint and will help the athlete to maintain a normal range of motion and will reduce the risk of injury. In this present study, the athlete also showed a normal stability at the shoulder joint, as the average score of the athlete after 3 trials was 23 touches, which indicates that the athlete has good stability at the scapula and the shoulder joints, which is very important for any overhead sport like badminton. Similar to this finding of the present study, a previous study have also reported that 21 touches in the closed kinetic chain upper extremity stability test showed maximized sensitivity as well as specificity and reduces the risk of injury in the upper extremity. In the current study, the athlete showed a normal range of motion at the ankle joint in both the legs, as shown in previous slide in figure 7 and figure 8. So the athlete just needs to maintain this range of motion while adding open and closed kinetic chain exercises along with proprioception and calf muscle strengthening and stretching, which at the end will improve the neuromuscular efficiency of the ankle joint and will help the athlete to maintain a normal range of motion, which at the end will reduces the risk of injury. In the present study, the athlete also showed a good stability at the shoulder joint, so he just needs to maintain this by adding ballistic training in order to enhance the efficacy and strengthen the rotator cuff muscles, which is very important for overhead activities to prevent injuries at the shoulder. Adding ballistic exercise to the athlete's program will help the athlete to develop quick and powerful movements, which is essential to enable the shortening processes of the stretches, which consist of the eccentric, the amortization phase, and the concentric phase. Moreover, ballistic training will also help to train the nervous system to react faster, which is very essential for fast sports like badminton. Finally, as the athlete was found to have a good range of motion at the ankle joint and a good shoulder stability, the goal of the training should be to maintain by doing 1 day lower body strength training and 1 day upper body strength training. During the warm-up, the athlete perform a 10-minute elliptical trainer on 1 day and 10-minute cycling on another day. After the warm-up, the athlete was asked to perform dynamic stretching on both the days. After the dynamic stretching, the athlete was also asked to perform mobility on both the strength session days. All the mobility and dynamic stretching was performed for 8 repetitions into one set on both sides, that is on both arms and both legs. After the mobility session, the strength session was performed by the athlete, and after the strength session, a static stretches for all the muscles for 30 seconds was also performed. Apart from doing the dynamic stretching, mobility and static stretching exercises on strength day, the athlete was also informed to do the mobility exercises every day before skill or conditioning session and static stretches after the skill or conditioning session to maintain the ankle range of motion as well as the shoulder stability. After the test, uh, this program was set up for the athlete. On the first day, the athlete was asked to complete these lower body exercises, and on another day, the athlete was asked to perform these upper body exercises. All these exercises was performed after completing the warm-up, the dynamic stretching, as well as the mobility session that was shown in the previous slide. This strength session involves in the lower body, especially in the lower body, involves all the open as well as close kinetic chain exercises along with calf muscle strengthening. And in the upper body program, it includes ballistic training such as the slams, the ballistic chest pass, and strengthening of the rotator cuff muscles, which is mainly done by the barbell bent over row and the dumbbell scapular row. This program will help the athlete to maintain his range of motion at the ankle joint and will also help to maintain the stability at the shoulder joint. Modern day sport has become very fast. Due to this, it requires higher physical skill, and thus it is the duty of the athlete, skill coaches and sports science team to integrate measures to assure that any unnecessary injuries do not stop athletes from fulfilling their full potential in sport. Injury inspection and preventive measures are just as important as early detection and treatment. In this study, 2 movement screening tests were conducted on a badminton athlete. The soleus wall test to assess the ankle dorsiflexion range of motion and the close kinetic chain upper extremity stability test to assess the stability of the shoulder. In both the tests, the athlete result was negative. So he just needs to maintain this range of motion at the ankle joint as well as the stability in the shoulder. This type of movement screening test should regularly be conducted with athletes as it will help the strength and conditioning coach as well as the coaches working in team sports or working with individual athletes to get an insight of the athlete's posture, and at the end it will help to prevent any kind of severe injury. These are the references that I have taken for the current study, for the purpose of the current study. Thank you.